My name is Danica Prenslow. I am a registered nurse. I work in an intensive care unit currently, and I have been a nurse for about 6 years now.
Perfect. So how did you first become interested in this career?
I became interested in nursing back in high school when I had a family member in a hospital and ran into some emergency department nurses. From there, I pursued talking to family members who were also nurses, and I received or went through training in order to get my nurse's aid, which is like a month-long course, and started working as that. Knew that I fell in love and wanted to continue working as a nurse for my career. In order to become a registered nurse, I have a 4-year Bachelor of Science degree in nursing, and then I tested to receive my license. There are multiple ways to get a nursing license that involves an associate's degree nurse or a bachelor's degree. Nursing is so broad. There's so many characteristics that accompany it, but I think the biggest one is having compassion and being able to jump into such a broad area. Another one would be communication. In every field of nursing, you're involved with so many other teams and people that you have to be able to communicate effectively. And my last one I would say is a willingness to learn. The medical field changes on a regular basis, and you have to adapt to that on a daily basis. Starting salary for a nurse is probably location based as well as what type of nursing, but for broad in terms, Colorado nursing, a starting salary would be about $50,000. You have the potential for growth just by year and the type of training that you receive. And I would say for average, at least within Colorado, you're probably going up to about $80,000 a year. Right, so my work environment currently is that I work in an intensive care unit, which means that I'm in the hospital setting. So I am around a nurse's station. I work with multiple different types of teams. I'm working with physical therapists, occupational therapists, dietitians, social work, chaplains, and then a whole group of different specialty of doctors. So within the hospital setting, that is what that looks like. But nursing in general has so many different areas that you can go into. Those settings change quite regularly. Typical day for an ICU nurse is a 12-hour shift. I work 3 days a week. I arrive to the hospital around 6:30. At 7, I end up receiving report from a fellow nurse on 2 to 3 different patients. We create a care plan, we hand off a report, and then my day looks like assessing that patient, giving medications, working with an interdisciplinary team with different members. We create a plan of care, and then nursing is usually the one who implements those interventions, runs clinical procedures, and continues to reassess and remake plans as that day to further the healing of that patient. I think the benefit of nursing is that there's so many different areas that you can go into. You can spend 30 or 40 years within your career and change every single year, and every single year you will have a different thing that you are doing. With that said, I think that's one of the awesome benefits. Even within the same area, I see and learn something new every single day, and I love that change up. Some of the challenges of nursing is that you are emotionally involved, and sometimes you can have a really great day, and some days you can see some really emotionally tough things that also make it a really rough day. I would say that this career is compatible with family life because there's so many different areas of nursing and areas of interest that you can find a job that works for you and the family that you're looking to accommodate for. Currently I work 3/12s, which means that I'm gone 3 days, and they're really long days, but it means that I have 4 days off and a ton of flexibility when I'm not at work. So I would definitely say that this is compatible. Favorite aspect is that I get to see so many things in a normal day in my life, and I'm constantly learning, and just that you are with someone in like the best and the worst and the hardest times of their life, and you have a huge ability to make a really big impact on somebody. This career, the nice thing about nursing is you are considered an essential workforce, and you will always have a job, especially in these COVID times. And I would say that as nursing continues to grow, it will be changing as always, but it will just become more technology dependent and electronically savvy as we continue to work, but there will always be a need for nurses in the field. Yes, for anyone who's interested in pursuing nursing, I would say reach out, look at the different areas of nursing that you could potentially go into, get involved. There's a million programs, there's a ton of people to talk to, shadow somebody, go receive your nursing assistant's certificate and start to get your foot in that door, and see if it's for you, because it's really rewarding, but it's definitely a career that you want to make sure that you get into knowing that you're going to stay in that.